fertility, birth control, menopause. This is Dr. Greg Naiman.
Dr. Ted Naiman, and welcome to another episode of What the Hell?
So how do you make men pause? It's menopause. So women out there, when we start talking about, again, these very important topics about fertility, birth control, or all of this related to, again, the cycle, the menstrual cycle. And then, of course, when they get to the point where they stop having cycles and now they're in the perimenopause and menopause, we want to start thinking about that. And we want to give a little bit of education as well as some potential guidance around what we can do. And again, this is not to be used as just the way you consume health. Of course, always come in and we will get you a little bit more information geared towards you. It's personalized. That's one of the first things we want to start with. This is very personalized.
So we'll start with fertility. You know, one of the things that commonly we'll talk with our young couples when they'll come in, I'm having issues with getting pregnant, and can I go in and maybe see a fertility specialist? A lot of times I'll take a second to pause and kind of just go through the normal physiology with my patients and explain to them the normal cycle of ovulation, and when we talk about ovulation, meaning when the ovum will kick out some eggs, and giving that understanding, because I feel like it's very important to understand that cycle. So for women, when we have the first day of your last menstrual period, it's approximately 14 days plus or minus 2 or 3 days is when you're ovulating. What that means is that your ovaries will kick out a bunch of eggs. What that means, if like today is the first day of your period, and about 14 days from now, plus or minus 2 or 3 days is when you're ovulating, and that means that's when the eggs are getting kicked out. So I always tell everybody, at that point is when you've got like a 2 or 3 day window or period of actually, that's where the semen or the sperm needs to come in at that time. And if there isn't any around there, after about 2 or 3 days, those eggs will essentially shrivel up and die up and go away. So you essentially will only have like 2 or 3 days, maybe 4 days tops during each month of getting pregnant. And then it's also important to understand that every time a male ejaculates, it can take them up to 72 hours for them to get enough sperm. So like if you're not timing ejaculation and sperm and semen to the time when you're ovulating, you've only really got a couple of days each month, and then you're essentially done, which is one of the reasons why we say that true infertility is not really something we worry about unless somebody has been trying for a year or 12 months and not been successful.
That's a great point. So when we're looking at it from a fertility perspective, usually when we're doing counseling around this, and it's family planning counseling, it's going to be back to, again, it takes 2 to tango, right? So unless you're doing in vitro, still essentially takes 2 to tango with that. But now there is a window of opportunity that you're talking about, and you have to know that timing. You got to know that that's happening, and you got to make sure that both people in this relationship are ready for that, to really make sure that you're maximizing that opportunity. So you have to remember that men also, we were created with testicles, so those are where it's outside of the usual body cavity, right? So as men are generated and their scrotum is forming and their testicles move, they're usually, when we're first in utero, meaning inside as a baby, still in the mom, your testicle actually moves down and then it pops through and then it goes into the scrotal sac. And it's in the scrotal sac because it has to be 1 degree cooler than the rest of the body. So there's all kinds of things in terms of optimizing for fertility and getting pregnant. So there's the male component of it and what needs to happen, and making sure that the ejaculation's not done and be ahead of time, and it's really geared towards there's enough sperm to be able to then get in and actually make sure that ovum is going to be successfully matched with the sperm. And then, of course, on the other side of it, it's going to be the female and making sure that there's the right timing for that as well. Now, it's also another thing we got to remind everybody that just because you didn't have a cycle doesn't mean you can't get pregnant, which is probably the next thing we would want to go into. It's this whole family planning component of it, and then birth control. So some people are like, oh, I don't have cycles, or my cycles are irregular, so I'm not necessarily going to get pregnant. It's not always the case. So there is still many times where that does happen. And then we get people coming back to us, and then we counsel them around that. And then they're like, what are my other options? And of course, your best option is abstinence, right? If you don't want to get pregnant, don't have intercourse. That's how you don't get pregnant. But outside of that, then it's going to be things that are from least effective to probably most effective. So abstinence, most effective. Least effective is going to be where they're doing it more from a rhythm perspective. And they're thinking, if done correctly, I'm not going to get pregnant because it's a rhythm and when I'm ovulating or when he's ejaculating. The next thing that is out there is going to be now more birth control pills. That's not necessarily going to be the most effective, but again, it's still very effective, definitely better than the rhythm, but not as good, obviously, as abstinence. Then you're going to have some of these other ones that are going to be hormone replacements, IUDs, and intrauterine devices. In other words, as well as implantables and progesterone or other hormone that will block from getting pregnant.
Right. And including barriers as well, obviously condoms and things like the cups and stuff that shield. So yeah, those are all. So we went from like fertility to trying to prevent fertility to
and now using diverse cycles.
Right. Right.
So the whole perimenopausal, menopausal phase where, boy, that to me is a huge topic in itself. Probably could just brush up a little bit on some of the menopause things that we need to talk about, some key points, and then we could probably have a whole session just on that on its own.
Yeah. So perimenopause, so menopause, or we talk about the pre, peri, and post. When we look at premature menopause is when a female starts to have or has menopause officially before the age of 40. So it's not uncommon for women to be 41, et cetera, and to be perimenopausal or even menopausal, and we wouldn't necessarily consider that premature. There is a lot of genetics around this as well. So if I generally tell women, what are other first-degree women in the family, like what was their history? So if your mom or sister, started menstrual cycles at a certain time and they went through menopause at a certain time, expect that you're probably going to follow the same trend because that tends to be somewhat genetic.
Right.
Beyond that, once the individuals start to kind of get those perimenal or premenopausal symptoms, and what that means is that the cycles might start becoming a little more erratic, a little more irregular. They could go up, they could go down, they could go several months without having any periods, and then all of a sudden kick in and then start having very heavy periods, and then oftentimes associated with other things that are more on the hormonal, I would say, psychological aspect of things, because of that withdrawal will start causing things. So you might start getting some vasomotor symptoms, you might start getting a little bit more temperamental, a little bit more emotional, a little more erratic than normal. Those are all normal things to experience. Again, when you
that must be a menopause,
right? Just like I'm dealing with my brother all the time. This guy's like, anyways. So these are things that, again, under the age of 40, we consider premature. Once you start having some of those changes or symptoms, and then the question is like, when do you consider it to be postmenopausal, or when are you officially done?
The real question is, why aren't people following us for more of this?
Yeah, and that's the question. So that being said, hopefully you guys learned a ton.
Yep, and that you follow us for more.
Right. Don't forget to like, subscribe, hit the button.